is with Metro Health Department, Director of Nursing. Good to see you today.
Nice to see you.
'Tis the season for giving and sometimes getting the flu. We are definitely in flu season, and it means it's time to get a flu shot, right?
Correct. So flu season typically peaks late November, December, and goes through February, but you can get it as early in October, and it could last through May as well.
And so the best time, is there an ideal time to get the flu shot?
Before the end of October, but if you haven't gotten it by now, still go ahead and get it.
Because sometimes I hear of people, even in late January, you know, you're through the holidays, you're into January, they're like, oh, I forgot my flu shot. Is it too late? It's not even then.
It is not too late, because that could still be the peak of the season.
But the best advice, get it as early as possible.
Correct.
Okay, who needs to get a flu shot? Is it just adults, or do young children need them as well?
Yes, the CDC recommends that everyone ages 6 months and older receive the flu vaccine.
6 months it starts?
Correct.
Okay, and are there any exceptions to this rule? Are there some people that might be allergic to the flu shot or have a problem?
Yes, you should talk to your doctor if you've had a serious allergic reaction to the flu shot, or if you've had a disease called Guillain-Barré disease, or if you think you're sick that day.
And what would happen if you did happen to be sick that day? It just wouldn't work? It wouldn't be effective?
No, usually if it's a mild illness, your physician can go ahead and give it to you. But if you have a fever, we suggest that you just come back when you're feeling better.
Okay, now there are certain populations that need the flu shot more than others. Aren't there people with illnesses where their immune systems are compromised, and it could be deadly for some of those people, right?
Correct. So there are certain populations that put them at higher risk for complication of the flu, and those include the children who are young, and especially younger than 2 years of age, older adults 65 years and older, pregnant women, and those living in long-term care facilities. And then also those with chronic medical conditions, like you mentioned, diabetes, lung disease.
Why is it, I don't hear people ask this question very often, why is it that flu season hits at the time of year that it does? What is it about the virus that makes it so prevalent this particular time of the year? Is it because we're all inside and in closer proximity to one another? Why this time of year?
Flu season typically always is in the fall season in the United States, so in different parts of the world it may be in a different time, but for the United States it's typically late fall, early winter.
All right, concerns about the shot. You know, you hear these fears, and are they really unfounded? You know, people are afraid of vaccines, and you hear some people say, I'm not getting the shot, I'll take my chances. Are those concerns, are they valid?
No, flu vaccines are very safe. They've been used for many years. So no, I mean, there's been studies that have proven that vaccines are safe, and they do save lives.
The flu can be very, very serious. Let's talk about what the symptoms of the flu are, and tell us more about the course of the illness if you do get the flu.
Okay, so flu symptoms, they can vary. So usually fever, headache, sore throat, runny nose. You know, that can last anywhere from 1 to 2 weeks. The thing with the flu that can be the most dangerous for people is the complications of the flu that could lead to hospitalization or even death.
What are the percentages of, you know, those cases? What are the numbers? You don't see that you don't see those in large numbers typically, do you?
You don't, but you see it in the higher risk groups that we talked about before.
And in nursing, do you see it in nursing homes or those populations, or not necessarily, because I would think they would have nurses on staff that would insist that they take the flu shot.
Right, but yeah, you do see it in populations that are in close proximity.
Okay, let's talk about where you can go to get the flu shot. Your doctor's office, some of these minute clinics. Where do you suggest people go, or should they come to the Metro Health Department?
They're always welcome to come to the local health department here, but there's also several area pharmacies, walk-in clinics, doctor's offices that have the flu vaccine available.
All right, many people still get the flu, or I shouldn't say many, people can still get the flu if they get the flu vaccine, correct?
Correct.
But
but it lessens the severity of their symptoms, or the flu illness may not last as long.
Okay. Are there any other preventative measures you'd like to talk about before we wrap up today, as far as protecting yourself from getting sick this flu season, whether it's the flu or just a bad cough, other illnesses, things that we can do to better protect ourselves?
Yes, so if you are sick, stay at home so you don't infect
Yes.
other people, and just good hygiene, wash your hands regularly, and if you cough or sneeze, cover your cough. So
Common sense things that we
common
always
sense
preach,
things,
right?
but yes.
And isn't it the happy birthday? You're supposed to sing happy birthday, and that's however many seconds it takes. That's how long you need to be washing your hands
Yes.
thoroughly, right?
Yes.
That's what you tell kids?
Yes, that's
You've
what I
told
tell
your
my kids
children,
that.
I'm sure.
I have.
Okay, Sanjana Stamm with Metro Health Department, thanks so much for coming in to educate us and enlighten us a little bit more about flu shots and the importance of getting one as soon as possible if you haven't already. We'll be right back with our next guest.